Hi, everyone. Thank you for joining us today. My name is Renee Hamer. I am Director of Student Recruitment here with the College of Nursing, and I am joined today by our Program Director, Dr. Dale. I'll let you go ahead and introduce yourself.
Hi, everyone. I'm Robin Dale. I'm the Health Sciences Endowed Professor and the Director of our PhD program. I have been at our College of Nursing since 2017, and I'm excited to talk to you about the PhD program today.
Thank you, Dr. Dale. We're excited to have you here with us. So just a little bit about what we're going to be covering today. Dr. Dale is going to go over all aspects of our PhD program and our research opportunities, and then I will pick back up with our admission requirements and that process, so you'll all will be aware of that. And then, of course, I'll have my information for you all, so you can reach out if you do have any questions. All right, Dr. Dale, after this slide, of course, we wanted to highlight that we have been voted #1 by US News and World Report for the online graduate nursing programs 4 years in a row for 2024. So we are excited about that, and we just wanted to share that with you. This obviously has a lot to do with our faculty that are involved with our online programs and the support that they give, even in this online atmosphere. So many of our students, all of our students are successful. So we definitely contribute that to our faculty support that we have. And I will turn it back over to Dr. Dale now.
Yeah, thank you, Renee. So the reason why that #1 online program is so important is because part of our PhD program is on the online Blackboard platform. So we have really refined our measures and adhere to quality matters standards. So you can be assured you're going to get a very excellent online portion of your PhD program. So first of all, let's talk about the difference between a PhD and DNP. This is a really commonly asked question, and you really want to know how to choose the right terminal degree for your nursing career. So you should be interested in a PhD if you really want to be a nurse scientist or researcher. The program is highly research focused, and you learn all aspects of conducting research so that you can conduct research in either a hospital setting or academia or industry setting. And you can also get a government job. So the options are endless when you have a PhD in nursing science. You may consider a DNP or a Doctor of Nursing Practice if you want to stay very clinically focused. And the main difference is you conduct original research or answer original research questions with a PhD, whereas in a DNP, you're taking existing evidence or you're going to the literature and finding what has been already studied, and you're implementing that in the clinical setting. So DNPs most of the time work in either hospital environments or outpatient environments to really improve quality patient care using the existing evidence. You have options of being clinical practitioners or executive leaders or scholars in clinical and leadership roles. You also have the option of becoming faculty in an academic setting in a school of nursing. If you have a strong clinical background and you have a Doctor of Nursing Practice, and your emphasis of your job will not be solely focused on scholarship and research. It's more around excellent clinical practice. And so who should get a PhD? Well, in our program, you can apply for a PhD if you either have a master's degree, a bachelor's degree, a DNP already, and you want that research aspect to further your career, or if you have a BSN with another type master's degree, such as Master's of Public Health or a Master's in Education. You don't have to have a BSN to get into the PhD program. If you had an RN degree with an associate degree and you went on and got a master's, then you also are eligible to apply for our program. And if you really want to concentrate on reading, writing, and research throughout your 4 to 5 years of study, then a PhD would be the right degree for you. A DNP degree is much shorter. It can be achieved in 2 years. So with a PhD, you've got to be committed for a longer program of study. And there's a really heavy emphasis on reading and writing as you learn how to conduct research and learn all the methods around research and how to do literature searches and go back and find the state of the science around a particular topic. If you are curious and often ask why things happen, or you just want to find out more about things, and or you're really curious about why do patients do this or why do they do that, then a PhD is the right degree for you. And if you want to have a larger influence on your community, be it within an inpatient setting, an outpatient setting, or the broad community at whole, then a PhD will allow you the credentials to study and improve things for that community. Like I said before, there's many career opportunities. They range from academia, government, health systems, and industry. And what is included in our PhD program? So you start with core classes, and it takes about 2 years taking classes 6 to 9 hours a semester. And the core classes cover things like roles of the nurse scientist, theory, nursing philosophy, social determinants of health and ethics, research ethics. Also, a large amount of classes on research methods, covering quantitative methods, qualitative methods, statistics, how to analyze data and how to manage data, and then how to critique existing research studies. So you can tell the difference between a good research study and one that hasn't been done with very good rigor. Then after you've finished those first 2 years of core classes, you also take electives or cognate classes, which are decided on between you and your mentor, and they should be classes to support your dissertation topic. So if you want to study something about babies or elderly adults, and you might want to do a qualitative research study where you're doing surveys and asking people their preferences on things, you might need additional electives around the population or the methods or those sorts of things. After you've finished all your core classes, which will include some of those electives, you take a qualifying exam, which is an assessment of your knowledge of the core concepts that you were supposed to get out of those core classes. That is usually at the end of your first 2 years in the spring/summer semester. And it's a very comprehensive exam that will take you a week to write, and then you turn it in and it's evaluated by your committee. And then they do an oral component where they ask you any questions that might not have come through really great in the written part. So you have a chance to fill in the blanks if you didn't answer it just right to their satisfaction. After that, you take a comprehensive exam, which is your candidacy exam, and it's your dissertation proposal. So it's written form and an oral form. The written form is actually your dissertation proposal, where you're doing a literature review around a topic. You're going over the theoretical framework that you'll use to study your topic. Then you go through a research strategy, your intent on how you're going to answer your research question. That will be evaluated by your dissertation committee, which consists of a dissertation chair within the College of Nursing, 2 other faculty who are on your dissertation committee that are College of Nursing faculty, and then 1 outside doctoral level member that will inform your research topic. So they read your dissertation proposal, and then they say, yep, you're set to present it now in front of us. And so you use a PowerPoint and you go through the same things that are in your proposal, the background with the literature, your theoretical framework, your methods on how you intend to study the topic, and then your committee asks you questions to make sure that they're ready to release you and you can start your dissertation study. Your dissertation study will take probably around a year to conduct. It might be a secondary analysis where you're using an existing data set to answer questions, or you might be prospectively recruiting participants and doing some kind of assessment on your research questions so you can answer your research question with those participants. After you have gathered all your data through your dissertation study, you will be analyzing it with the assistance of your dissertation committee. And at the end, you'll defend your dissertation, which means another written component where you have 3 manuscripts inside your final dissertation. One is either a literature review or a theory paper or a methods paper, and then 2 database papers, which means they are papers written about your research results that you did over the course of your study. So you're going to hand that into your committee. They're going to read it and assess it and assess the rigor of your study. And then you're going to do another PowerPoint presentation to present your results. But this time, the entire public is invited. Your fellow students or your family or other faculty in the College of Nursing, as well as your committee. So you present your results in front of them, and then they excuse all the public. The committee asks you questions, and then they say, yes, you passed, and then you graduate. So why us? Why do you want to choose USC for your PhD? We have an excellent, excellent reputation. We have stellar faculty and researchers, and you're at a tier 1 research university that is really known throughout the nation for our fine research. We have many, many faculty researchers across the campus that are well funded with the National Institute of Health and National Science Foundation. The other reason is convenience. We offer an executive style delivery, which really means you come into campus 1 week in a month, every month, for fall, spring, and first year summer semesters. So you're coming in on a Friday and you have classes all day Friday, you spend the night, and then you have classes on Saturday. And then you go home and you finish the rest of your coursework over the month on the Blackboard platform, asynchronously, which means you don't need to join up with your classmates in between that month period of time. We have individual plans of study, which means you work with myself and your dissertation chair, which is assigned right when you are accepted to our program. And you design your course of study over the next 4 years and what kind of electives you're going to take and when you're going to meet your benchmarks. The faculty mentorship within our program is really excellent. We take a lot of time to match you with just the right person who might be an expert in the content area that you want to study, or they might be an expert in the methods that you want to use to study, or they might be an expert in the population that you're studying. And how I determine this is during your application procedures, you submit your application, and if we feel like you're qualified, we invite you for an interview. And I send out your intended area of study, which you talk about in your personal statement. I send that out to all of our PhD faculty, and then they say, oh, I want to interview that student as a possible mentee that I can work with. So we set you up with an interview with 2 or more faculty, and they ask you a lot of questions to determine if you might be a good fit to work with them, and then we see if you like them and want to work with them. So after you're accepted and before you enroll, I'll let you know who your faculty mentor is. And then that person is going to walk you through your entire program. And the reason mentorship is important is because Not only are they helping you with your dissertation topic and all your classes, they're also helping you get published, and they're helping you network through the national nursing community. We have many scholarship conferences. They will go with you to those conferences, introduce you to people, and really network you to help you eventually get a job after you graduate. So the mentorship is extremely important. We also have opportunities for interdepartmental research and certificate of graduate studies, which means along the way, while you're taking electives, you may also take some extra classes to get a certificate in something like international studies or technology, or something that might also help you with your career. We have scholarship opportunities, which includes right now at this moment funding for your first 36 hours of coursework. And that is a huge resource for you. That will cover about the first 2 years of study. And then after that, there are loans in the state of South Carolina. There's loans on the national faculty, and the loans are paid back by the entity as long as you work as faculty in either the state of South Carolina or nationally, depending on what you get. We also assist you with submitting grants to the National Institute of Health, and they will cover your last 2 to 3 years of coursework, as well as give you a stipend while you're at school. That's called an F-31 or NRSA. So there's a lot of opportunities, and the grant opportunities offer you practice so that you can write grants once you graduate and get your first faculty job. Research opportunities are huge at our College of Nursing because we have so many researchers. And if you go to our College of Nursing website and go to the research page, you will see all of these choices. If you click into them, you will see all the faculty that are doing research in these areas. Our signature science, which we believe is our strength in the College of Nursing, covers just about anything that you might want to study. Chronic conditions and care transitions, we have several faculty doing research in that area. Many stellar faculty are doing research in health equity. We have interprofessional education and training. I am the director of the Perinatal Pediatric and Family Research Center. So we have faculty doing research in babies, children, and mothers and families all the way across the lifespan. Also research across the cancer continuum. So many options there. The other areas that you see, biobehavioral research, digital health, and health biomarkers, are areas where we have many faculty researchers as well. And you can click into those and see which faculty are doing research in those areas. And we have a wide methodological expertise. Community engagement, community-based participatory research, that's a particular method for working with communities and actually working with the communities to conduct research and having them involved in your research. We have experts in qualitative methods, which are more about analyzing either observations or words, interviews, those kinds of things, or quantitative research, which many of our researchers do analysis on data quantitatively using sophisticated statistics. And then there's mixed methods, which pulls together studies that have a piece that is qualitative and a piece that is quantitative. And then you pull it all together and integrate those data so that you can come to some summary conclusions about what you're studying. We have experts in randomized behavioral clinical trials and clinical trials in general. So we can give you baseline entry information on how to conduct randomized clinical trials and offer expertise in how to conduct feasibility for interventional trials. We also offer research centers and resources. So our research centers are groups of faculty that meet together every month, all year long, every year, around certain topics or populations. The Cancer Survivorship Center meets together with internal faculty and external faculty about cancer survivorship. The Acorn Center, or Center for Advancing Chronic Care Outcomes Through Research and Innovation, is a very active center. They do a lot with students at all levels, bachelor's through doctoral level. And I think you might have interest in joining that center. Like I said, the Perinatal Pediatrics and Family Research Center, we meet monthly. We include students as members, and you can get very involved with faculty at that level to give you extra research study activities. We also have overall the Office of Research, which assists students in grant submissions, posters for conferences, and any other needs that you have as far as general research. Our teaching resources are really excellent across this university, and the university is known for this. We have the University Center for Teaching Excellence, which really provides support for faculty and student professional development, pedagogical consultations, instructional design and support. And they offer certificate continuing education programs where you can learn to teach. So that would be one resource where you might want to take some extra informational things about teaching, so that once you graduate, you can get a job and say, I've got this information on how to teach. They offer a certificate called Preparing Future Faculty, which many of our doctoral students do. You can do that over the course of your study in your 4 to 5 year program. And once you graduate, you'll have that certificate, and you can put it in your CV for when you go to get a job that shows that you did this and you're prepared to become a faculty member.
Thank you so much, Dr. Dale, for sharing that information about our program. I am going to take over now and talk a little bit about our admission requirements and the process for admission. And some of this you'll hear again, as Dr. Dale has already mentioned some of this. We just wanted to provide it on a slide for you. So you do have to have, here you see some of the qualifications in terms of a BSN, or you can also have an RN and another form of a master's degree with a BSN. So lots of different routes to the PhD program. So that is something to take away from this. We do require that you have a 3.0 on all prior coursework, and we are looking again at that cumulative GPA of a 3.0. Dr. Dale mentioned as well, there is an interview process. So through that interview process, if you do move forward through the application process, would be selected for an interview, and there is, of course, an opportunity for you to meet with faculty based off of your desired area of study of your interest in research. So that is all part of the application process as you move forward. In terms of how to go about submitting your documents, where to submit them, those types of things, we do have an online application through our website. And with the online application, you will provide a personal goal statement detailing, of course, your interest, why you want to be a part of the program, any research opportunities, those types of things are very important. There will also be prompts on the application as well. You will submit your current resume or CV as a part of the application. Your unencumbered nursing license will be needed as well, in addition to 3 letters of recommendation. The 3 letters of recommendation do need to come from someone in the healthcare field with a doctorate or higher. And through the application, you will have the opportunity to upload your recommender's information on the application, and then they're sent details how to submit that recommendation for you. So again, there's no you getting the letters, uploading them, those types of things. It all is electronic process through the online application. And then we will need a copy of all of your transcripts. So if you have, I'm sure many of you at this point may have attended multiple institutions. We will need each of those institutions' transcripts, no matter if you took, a few classes at one institution and it's on your final transcript, we're going to still need all of them individually. So just keep that in mind as you go through all of this. And we just wanted to put before you the application deadline. So the application does open October 15th. of every year, and we do have an early decision of January 15th. So typically for those who have everything in by January 15th, typically by towards the end of April, 1st of March, is that right, Dr. Dale? Those
That's
students will
right.
have an admission decision. And then, of course, we do have a final deadline of March 15th, which, of course, those students typically by mid-April, or if not before, have an admission decision. So just keep that in mind, again, as you're looking at the program and when you need to submit information. The earlier, the better, of course, in terms of financial aid opportunities and those types of things. So if you have any questions about that, definitely let us know. Dr. Dale did mention some of this, but again, here is some of it captured on a slide for you as well. Lots of financial assistance and funding opportunities available through the program. You see here assistantships, tuition funding. That is what Dr. Dale mentioned for the first 36 hours of all of our students admitted to the PhD program. That is something that is currently offered right now with the College of Nursing, that those first 36 hours are covered. And then outside of that, you can see these other opportunities. We have the Bold Career Pathway Program. That is something with the state of South Carolina. That is a loan reimbursement program if you are willing to teach at least 2 years after you graduate or be a faculty member full-time or part-time. There is an opportunity for full reimbursement for your program there. And then the other ones you can see here, I know Dr. Dale touched on those, but we are available if you do have any questions about any of this. You can also find it on our website. I have my information here for you as well. So definitely reach out to us if you do have any questions. But we hope to see your application and look forward to hearing from you with any questions you may have. Thanks and have a great day.
Thank you.